Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic, is my hip pain coming from a hip problem or a lumbar spine problem? Hip pain is very common. Millions of Americans suffer from arthritis in the hip, which can cause significant disability and limited ability to walk, exercise, participate in recreational activities. There's about 300,000 total hip replacements performed annually each year, so there's about half as many hip replacements as there are knee replacements. When pain is occurring in the hip area, it just seems obvious to assume the problem is actually coming from the joint itself. But it may not be coming from the hip. When pain is being felt in the hip, there may be an overlap in symptoms between hip arthritis and lumbar spinal stenosis. As we age, spinal stenosis is very, very common, just like hip arthritis, and both are due to degeneration. So here's what a cartoon of spinal stenosis. It occurs with degeneration of the disc, which then leads to degeneration of the spinal joints called the facet joints in the back of the spine. Okay? So what happens is, just as you get with like a knee or hip arthritis, you can get bony and soft tissue overgrowth in the area of arthritis, which can then start to impinge on the spinal canal, which is here, and then pinch on nerve roots as they're trying to get out from the spine. What you can end up with is pain that can end up in the buttock, into the hip joint, and down the thigh that can mimic what you experience with arthritis. So how do you differentiate between the two? Okay, well, imaging studies can help. Here's an example of what you can see on an MRI, where you have significant disc bulging going back from degeneration, but then you also have a lot of bony overgrowth from the facet joint arthritis with some of the tissue coming in. So here you can see at this slice, you have like no room for what's going on in the spinal canal, and you can see that on this cartoon here. Okay, so that can be one thing to look at, but you may have this kind of an x-ray or MRI and not have any symptoms. Obviously the doctor will get a pelvic x-ray or hip x-rays, and you can see in this, this is a normal one. You got nice joint space, nice spherical looking femoral head. You got this other side that looks just god-awful. You have really minimal joint space. You have some cysts noted from arthritis, and then the white appearance is due to hardening of the bone because it's stuck in an arthritic state. Now, so obviously this is arthritic, but is it painful? Maybe, maybe not. So there are a few ways to differentiate. One is history. So if someone says, well, I have a lot of pain as I start to walk, and then if I'm walking uphill, it's not so bad. If I'm walking downhill, it's terrible. Those types of things are more indicative of like a spinal stenosis situation, because when you're walking uphill, you're leaning forward and you're opening up the spinal canal. If you're walking downhill, you're leaning backward, you're closing it down. Some people will say, I feel better if I go into the grocery store when I'm leaning forward on the cart. That's right out of a textbook, spinal stenosis, because you're leaning forward and opening up the spinal canal. Okay? So sometimes a history, and there's other things too, but on physical exam, if someone has point tenderness and range of motion pain with the hip, then more commonly it's going to be something coming from the hip joint. A neurologic exam is not really helpful for differentiation. So once again, imaging studies, this is actually a different type of slice. Normally this is almost a circle, but because of the arthritis and overgrowth, they call it a trefoil, a triangle. So, this is what I was talking about. Degenerative lumbar facet disease, arthritis, and then thickened soft tissue, the ligamentum, and it really can pinch on nerve roots as they're trying to get out. So the best thing to do is a diagnostic injection, okay? If you get an injection right into the hip, that is where the pain is, the side that it's on, and you put numbing medicine in, it should relieve the pain if it's all coming from the hip, all right? Same thing goes for the epidural. If the diagnosis is, well, you have hip pain, it seems like your lumbar spinal stenosis is at this level, L3, L4, then, let's see if that's it. If you do the epidural, it should relieve the pain, either all of it or some of it. So here's the potential outcomes with a hip diagnostic injection. If you get complete hip relief with a hip injection, it's a hip problem. If you get complete hip relief with an epidural injection, it's a lumbar spine problem. If you get some relief from a hip injection and the rest comes from an epidural injection, then it's a combination of the two, which is, not great. You have lumbar spinal stenosis and you have hip arthritis. There's always the possibility that neither injection will work very well, or there's still a little bit of question marks in the doctor's minds. In that case, further investigation may be necessary. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics in the area. Over 50 insurances are accepted. Over 25 treatment options are available with the board-certified, award-winning doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.